Hello, good morning everybody. Anybody online? This looks like it's quite sunny today in KL. Hello, thanks for joining us. Can you hear me all right? Hello. Can we do a sound check? Can you hear me okay? I'm trying something new today. Hello, Michael, how are you? Long time no see. Good morning. So you can hear me okay, Michael? That's good. Hello. So we're stuck here. We're stuck here. We're not getting anywhere. Okay, right. Good. Excellent, Michael. Let's get started. Right now, the other day when I was doing this, I had a lot of challenges, in terms of the pictures being upside down and sound being not so good and so on. So hopefully today is better. I think it looks brighter as well. Hopefully you're okay. Anyway, so we're still into the very high figures, but we won't worry about that now. Yeah. Now today I want to talk to you a little bit about doctors, hospitals, and the health industry. Now we all assume that doctors and hospital, private, public, and so on, they are in the health industry, right? And then even the ministry is called the health ministry, right? So, but really, are doctors looking after health? What do they? Hospitals and doctors only come into play in most cases when somebody falls sick, right? So you have an illness, you go and see a doctor. You may say, even if you're not aware, then you get some medical checkup and found out that you have some disease, right? And then only and they go and see doctor and so on, right? So strictly speaking, right, doctors, healthcare professionals, and hospitals are not really in the health industry. They are in the sickness, illness industry. Hello, Eugene. Hope you're keeping okay. Now, the sickness, illness industry, because you only get involved as a patient when you fall sick, or you had an accident, or something. So, but if you're well and so you don't really want to go near the hospital, and especially in this pandemic, even people who have diseases try to avoid going to hospitals, right? Because they're a bit worried they may get something from the hospital. So hospitals are in the illness industry, not the health industry, right? So maintenance of health depends not only on the hospital, because by the time people get to hospital, that is by the time they fall sick, right, and go to see doctor, specialists, cardiologists, and so on, it's a little bit late, because they have reached quite way down in the path already, right? So it passes from wellness, fitness to sickness and death, right? So you're quite far down that path, right? And so, strictly speaking, it's not really the health industry. Right? Now, there is a wider spectrum of health and wellness industry, right? Which is probably more important, because to me, prevention is always better than cure, right? So the wellness industry promotes fitness and wellness, well-being, and health, truly health, right? Because if you maintain your health well, you maintain your body well and so on, then you can perform better, right? You can live better life, and you don't need to spend time and money on doctors and hospitals and so on. And that part is actually, when you're in hospital, it's no fun, right? It is suffering, really. Okay, you might undergo operations and so on. Even say, we cardiologists do angioplasty, and next day you can get out and so on. It's still, some degree of suffering, and there's a bit of risks and so on. And don't be misled by. Oh, I see. I'll speak up a bit more, maybe. Is it better? Sorry about that. Let me say the sound is not so good. Anyway, I'm just sorry, Michael said earlier that it's loud and clear. Anyway, so, don't be misled by procedures and so on. Like, when somebody suffers from heart disease, he comes to hospital. Okay, sorry, let's change my tactic a little bit. Is the sound better now? All right, great. Thank you. So anyway, we were talking earlier that when you come to hospital, right, you're not, you seek treatment for illness. Right? You don't seek treatment for health, really. So don't be misled that when you come to hospital and the doctor does something to you, that's the end of the story. Now, for instance, if somebody has heart disease and come to hospital, right, and cardiologists usually would do angiogram, take a picture, and then usually would open up the artery and put a stent in, right? So that's the end of the story. But it's not, you see. It is not the end of the story, because you have another risk, right? That is that whatever that's done can still happen again, especially with something which is foreign to the body, that's inside your coronary artery, right? So, and a lot of times doctors can only help to some extent. We call it palliation rather than curing the disease and so on, right? So now, some of you know that I've always been interested in the prevention of diseases, heart disease and so on. So prevention is better than cure. Right? So now let's come and look at the wellness industry I mentioned earlier. The wellness industry is huge. Right? Now there is a global body called Global Wellness Institute. Hello, mentor. Hello. Global Wellness Institute, that's in the United States, estimate that the wellness industry, right, is worth something like 4.5 trillion US dollars. Trillion, right? You know how many zeros a trillion? 12 zeros. Right? So it is one step up from billion, right? So it is huge, right? So, but of course it encompasses a lot of different activities, but still, at the end of the day, this is for the wellness of each individual, right? This is truly the health of each individual, right? So now, it is not as big as the overall medical industry. It's about half the value actually. But then for medical industry, you need to have all these big hospitals and so on. And then to get really involved, and for doctors, you have to go through, so many years of university education and further training after that, even for nurses and technicians and so on. You have to go through a certain level of educations to prepare yourself. And then you're at a time, once you're qualified, you get employed by a hospital, and that's the end of that. But if you look at the spectrum and the size of the wellness industry, there's huge potential, right, for anybody, whatever background, not only doctors. In fact, doctors are not great at doing this thing, right? So to get involved, right? So the basic idea is to help people, right? Help people with their health and also with their wealth, right? Now, as doctors, we can only help them a little bit. As I said, we treat the illnesses, right? And hopefully they would regain some degree of health, right? So, but that's the end of that, Whereas in the wellness industry, if you're involved, whether you're a doctor or an engineer or a businessman and so on, it's not really important, right? Because what we're promoting is the concept of health, the concept of prevention. It is not taking medication, right? Because if you have to take medication, then actually you're a bit too far down the line, Of course, you can still help and so on, right? So now, so this wellness industry incorporates the supplements and all the other potential avenues to help each individual to regain their health, to maintain the level of fitness, right? So this is particularly important and extensive, well carried out in countries like Japan, right? Now, when we look at, like in this country, people retire, like teachers retire when they are 50, something like that, and some other people will retire maybe 60 and so on, right? And then after that, what? Well, some people go and play golf, but you can play golf every day unless you're a professional golfer. You probably get sick of it, right? So, but there is increasing possibility now for people to live to be ripe old age, right? Beyond 100 years old, if possible, it's possible. Now, Japan, certain parts of Japan have a large number of centenarians, right? These are the people who live to be more than 100, right? So, there was a study, prediction, recently published, saying that the people who were born in Japan from the year 2007 onwards, right? So 2007, at least 50% will live to be more than 100. Right? So presumably these are the people who stick to the traditional Japanese lifestyle and diet and so on, and relaxation. Uh, and I was reading last night, there was something interesting called forest bath, forest therapy, where you spend time with nature, so that relaxes your mind and so on, and that promotes longevity. Right? So if you look at the local situation, after you retire, you still have maybe half your life left, So how do you want to spend that? Just waiting to go to the next world. Right? So anyway, so wellness is a huge thing, right? And because it is coming more and more into the scene now, right? That people take care of themselves, and people are more and more willing to spend money, invest in themselves to promote their own health and wellness, and to avoid getting sick and spend money in hospitals, right? So there was a Chinese, Zhong Nanshan, right? One of the pioneers of the fight against COVID and success story in China. The quote from him say that if you do not invest in your health, right, when you're working and so on, right, you will spend all your saving later in life, right, on doctors and hospital. So whether you are willing to spend a little before this happens, or give the lump sum to hospital and doctors when something happens. So that's probably not really a very good way to spend your saving, especially when you have retired from whatever job you're doing and so on, right? So now, as I said, the wellness industry is huge, and the entry into it is quite liberal. That all you need is the desire to learn a few things, but more importantly, the right mindset to help people, and to pursue your dreams, right, in whichever field you want. Right? So if you are interested in this wellness industry, do leave me a message, right, and get in touch. We can explore further, right? And it's to do with building a network of people around the world that support you, and care for you, and create positive energy, despite all this negativity that surrounds us anywhere around the world, especially down here in KL, in Malaysia, where daily we're facing thousands and thousands and thousands of cases. So that is very, very important. Anyway, that's as much as I have to share today. If you like what you are looking at, what you're hearing, do leave a comment and like and share this video, and do get in touch if you want more information on what wellness industry is about and you want to get involved. Thank you for joining us. Bye bye. Stay safe.